So want to talk today about annual wellness exams. And I know that there is some confusion around what takes place in those exams and what folks can do. And it's really important, as you know, to have those exams at least once a year. I would say you should be seeing your senior patients more than once a year. But let's break down what exactly Medicare fee for service and Medicare in general covers, and then what's covered as preventative services under Part B that you might consider doing as part of your annual wellness exam. And so the annual wellness exam, as CMS has it, that's billed as a G0438 or a G0439, is intended every year to collect the latest history on a patient. And so during that visit, you would do things like collect anything about personal history. So wanting to know if they're a smoker, what their house is like, whether or not they have access to food. And so you can do all of those screenings around daily living and anything around social determinants of health. You would also ask things about family history. Is there a family history of diabetes, say, or cardiovascular disease? Things that would give you insight into conditions that might be a risk for that patient and that you would want to care for them potentially differently. Other things that you would ask that are part of the standard annual wellness visit, again, that G code would include depression screening, substance use disorder, checking prescriptions. I know I had mentioned activities of daily living, but making sure that the patient can ambulate well around their home, that they're not at risk for falling, et cetera, et cetera. And so really when I think about the annual wellness exam, it's more akin to not laying on of hands. It's about answering questions or getting information right from that patient. And so really your interview skills have to be on point, I think, to get rich information. Where a lot of the confusion lies is that there are other exams, right? And it's taking place under the auspices or under the umbrella of that annual wellness exam that we do a lot of times to capture additional information. And a lot of folks get concerned because if under traditional Medicare, they could carry a copay. But under Part B, it depends really on how you're billing it. They're listed as preventative exams. And so things like checking, right, the EGFR for kidney function, or checking A1C, or doing a peripheral vascular disease test, right, screening. All these types of things are typically covered under Part B, wouldn't carry a copay for the patient, and could be done, right, during that annual wellness visit. So again, it's not part of the annual wellness visit as it's written in fee for service. But with Medicare Advantage organizations, a lot of times they've expanded, right, what they're able to do during those exams in the effort to get greater, richer history on that patient. And I think that, to the extent that you can get that additional information on your patient, that's really the way that we need to be thinking about how do we make sure that we have a comprehensive history on our patient and really have a full understanding, right, fully circumspect of where their health is, I think is important. The other thing that I would recommend, and again, this isn't just for Medicare Advantage organizations, this would be anyone that's in a risk-based um, contract, because you want to make sure that you are accurately portraying the health of that patient, right? And what their supports are in the home. And so, to the extent that you can get their health history, their social history, right, their mental history, all really, really important, and all important to those risk-bearing contracts. So whether or not you're involved in an ACO, if you're involved in Medicare Advantage, right, I think it's worthwhile to have that data. I personally think it's worthwhile on that fee-for-service patient too, because it is going to, I think, shape, right, how you work with that patient potentially. And so our thinking really needs to change as we move into this risk-bearing this risk bearing era that we have in healthcare. The other thing that I would recommend, and I know that the G code is only used. Now, here's the key thing, and I know a lot of health plans have helped with this if you're a provider group around the logistics. But the thing to remember about that annual wellness exam is that it is only, you can only bill that code once every 12 months. And so once you've billed the initial code, right, in the first 12 months, and then you've billed subsequent codes every 12 months, you can't bill it again. You could run it, right, if you're in a capitated arrangement, depending on how your contracts are set up, if you're a provider group, under those, basic office visit codes, to ensure, again, I think it's really important that the patient, to the extent that's possible, right, doesn't have a copay, because we want them, right, to feel like they can come in and share that information and to relieve as many barriers that might be present for that patient, I think is important. But also, too, want to encourage everyone to see those patients more than once a year. A lot of times we think about that annual wellness exam and it gets done in the beginning part of the year or it gets done around the birthday. 12 months is a really long time in a senior's life to let go by and not expect that something hasn't happened. And so, you could do an annual wellness exam, say in January or February, and then March or April, that person experiences maybe the death of a loved one that has affected them, significantly, or there's been some change in their health, and things can change very quickly. And so, even though the annual wellness exam is intended only to take place once a year, want to encourage folks to the extent that they can under their contracts, make sure that they're seeing patients on a regular basis. We know that our seniors should be seen at least 5 to 8 times a year. Statistically, that's about the right number, to make sure that they're getting in and that you're assessing their conditions fully so that you can manage them. Because when we think about value-based care, it's not just about risk adjustment, right? And capturing risk. And I know I talked a lot about that in the beginning, but it's also about the ability to talk about prevention, make sure that you're closing those quality gaps. And so I know I alluded to some of those early on. But then, too, staying on top of total cost of care. The more often that you're seeing that patient in that primary care setting, you're able to manage their visit, right? Get them the care that they need in that office visit, as opposed to them going to the emergency room, right? Getting admitted to something that could have well been managed had it been caught earlier in the home. And so, things to think about as you're seeing patients and you're thinking about the annual wellness exam.